Welcome to my podcast. Today I'm going to talk about another common case that you can face in the clinical setting, and it can happen, as we all know, on Friday's night or on the weekend when people or men usually get into a fight with each other. So after you introduce yourself, as always, we agree, double check the patient name, date of birth. You'll ask the patient, how can I help you today? And the patient will be mid-30 or so, presented with pain, mild swelling, and restriction in their hand, in the dominant hand. And usually they're office worker or whatever, and they will not confess early on, but later on they're going to say, I had a little drink, and then I had a fight before going home, or I was over enthusiastic with my mate for some sort of work or some sort of competition. And in my way home, I struck a bar or telegraph ball with his clenched fist, obviously. And after then, he felt pain, noticed slight bruising and tenderness and the restriction of the movement, obviously in the hand. So you will ask the patient, do you have any thought what might be the reason for this pain after you hit this ball? Have you had this experience before? Is it only your first time? Had you been into any fight before? Any thoughts or any ideas? So the patient say, oh, I think it's only after I hit my hand, and I don't know, and maybe this is his first, or maybe multiple, wherever. You'll ask the patient, do you have any medical history of any sort of problem, any family history, anything that you need to know, any medication that you take in the long run, and what's your lifestyle like? And then if you have any issue with other bone issue or joint issue, and the patient will decline all of that. And you will ask the patient, can I have a look, quick look on in the area affected? And you will see that his right hand, basically in the medial side, you find that there's light swelling, bruising, no abrasion, no cut, and some sort of restriction. You'll then send for an X-ray, anterior, posterior, and lateral. And while examining the X-ray, you will see that the neck of the fifth metacarpal bone has been fractured. Maybe there is angulation toward the medial or palmar or wherever. And you'll explain to the patient the X-ray finding and what should be done moving forward. So the typical mechanism of this sort of injury is usually direct trauma to clenched fist, and always seen in the street brawls or fights that involve punching hard objects, and it's mostly commonly seen in men more than women. So in this situation, we need to address the condition appropriately because any malunion or non-union or malalignment can affect the site negatively in terms of the grip strength, dexterity, and it could have detrimental functionality, effects on the functionality of the daily task and chores. So this brings up my hand, my left hand, as I say before some of the podcasts, if you have heard them. I was assaulted by e-bike rider 3 years ago when I was walking in the pavement in the UK in my own base. An e-bike at high speed struck into my back unexpectedly, and he caused me a fracture of my left hand pinky, fracture of course my nose, my right knee, have whiplash from my neck. The problem with my nose, they never addressed it immediately, so now I'm having nerve damage. I'm having literally breathing from one nostril, and it's switch, and especially at night, it's far more pronounced along a mucus buildup, very sticky and very small, irritating all the time. You need to clear your throat, and it's very, very annoying, very, I don't know what to say. Well, that's the situation now. What should I do? Well, on my left finger, because around Christmas time, no one bothered to correct my finger. And I was only seen by a nurse. She was really harsh. She didn't explain anything. She didn't tell me what should be done or whatever. And of course, I'm not a hand or an orthopedic doctor, so I don't know all of that. I'm just a dermatology doctor. And the saga was really endless. And now I can tell you, I mean, because they didn't fix my finger, so it's all the time it's clicking, it's painful, and it's sore. It's have that sort of deep ache along all the area. It's affecting my grip strength, and many times I can't hold with my hand. And you need all the time, you have that kind of feeling that you need either to chop that finger out or try to straighten it because it's inclined to the middle finger and it has a wide gap between, and affected, fractured, malunited, malaligned little finger in the left side with adjacent ring finger. If I'm going to tell you about the documentation, it's hilarious by all means. Everyone writes what they think. They never follow up with what has been written. Some they say those tricky words. Oh, I can't be sure the finger is mal-rotated. Or he will say, the finger is significantly angulated, but I can't be certain of the malrotation. Obviously, it's malrotated. It's quite clear, especially now when it's all united, all malunited. You can see the finger is rotated, and in trying to flex it or bend it, it feels very restrictive. It feels like it's not gonna bend as a normal finger, and because we know the hands is very small bones, if the anatomy is disturbed in any way, it will affect the rest of the functionality, and obviously no one understands any of that, and just the anesthetic is very hilarious. That's all what I can say. Anyway, so what I'm trying to say here, any fractures, those sort of things in the hand should be addressed immediately, because a small thing then can affect the functionality of the hand. So if it was a close fracture without any substantial angulation, which we would say below 30, I remember I was asking the questions, what's the angulation of this fracture? No one tried to give, and when I insisted to know, everyone says different things. Some say 30, some say 35, some say 40. Obviously, they can't even agree what's the right angulation. And you need to make sure that this fracture is not malrotated, because we know hands, they are very delicate and small bones, and there's a lot of the muscles which between metacarpal, which is the interossei, because those muscles, they will pull, and that's why the angulation going to happen. And of course, when the bone is fractured, it's displaced, can't be held in position, and therefore the malrotation, even if it's a subtle one, it will occur, and those kind of things should be addressed with a splint in a flexed position. That's the thing, they never done it to me, and that's why I left with this finger now. It's shortened, it's inclined on the side, and I remember when I was seeing the physio, when I told her about the clicking, she kept saying, we need to inject intralesional steroid. I am not quite sure what's intralesional steroid for, and she kept saying a ganglion or whatever, I don't know I can't even remember. She said that there is like a ganglion that we need to inject, and I told her this is because of the malunion, because of the wrong fusion. And obviously, of course, I declined the intralesional steroid because there's no point of this, and the click is still now. So that's just prove my theory. That's why I'm having this click. Anyway, if angulation is more than 30, and if it's complicated like comminuted fracture, or if there is neovascular compromise in that condition, of course, surgical review should be considered in order to try correct any subtle malunion or mal-aligned small bone in order to try to preserve the functionality of the fracture of the hand. And this is obviously a fracture caused by the person themselves, not like in my situation, someone caused to me. So I hope by that I bring some lights about problems with the hand or the fracture and how you need to address them, and not let them, because once it's not united rightly, it's going to cause a lifelong issue and compromises. Let me know in the comment down below if you have an experience with this sort of fracture, whether yourself or your patient or any relative, and how it's gone. Thank you.